Have you ever felt a strange tingling in your hands or feet, as if they were small electric shocks or pinpricks? Have you noticed your memory failing more often, forgetting simple day-to-day things? Or perhaps that persistent fatigue that doesn't go away even after a good night's sleep? These signs may seem common, but they can hide something much more serious: the silent deficiency of vitamin B12. This is a problem far more common than most people imagine. Studies indicate that a significant portion of the world's population shows some degree of insufficiency of this vitamin. And what's most concerning is that, in most cases, the deficiency is only discovered when the symptoms are already advanced, often causing damage that can become permanent. Many people think that vitamin B12 deficiency is restricted only to vegetarians and vegans, since this vitamin is mainly found in animal-based foods such as meat, eggs, milk, and fish. But that's not true. Even people who regularly consume these foods can present a deficiency. This happens because several factors influence the proper absorption of B12, such as natural aging, intestinal changes, continuous use of certain medications, and even eating habits that appear correct but are insufficient. And why is this vitamin so essential? Vitamin B12 is responsible for vital functions in the body. It participates in the formation of red blood cells, helps transport oxygen, protects the nervous system, and is directly linked to the production of neurotransmitters that regulate our mood, energy, and mental clarity. When levels drop, the body begins to show subtle signs that, if ignored, can progress into serious conditions. The symptoms of B12 deficiency are often confused with overwork, stress, lack of rest, or even premature aging. However, the root of the problem may be precisely the lack of this essential nutrient. And that's where the danger lies. When we fail to recognize the signs, the deficiency advances silently and compromises quality of life. Throughout this content, we will dive into the 4 most severe symptoms of vitamin B12 deficiency. The last one may even seem harmless at first glance, but it is precisely the one that raises the most important red flag. We will also understand why many routine tests fail to correctly detect the deficiency, and what range is truly considered ideal by specialists to keep the body protected. This information can make the difference between living with energy, mental clarity, and vitality or facing serious problems that could have been avoided with a simple adjustment. So stay alert, because from now on we will reveal signs and insights that can transform the way you see your own health. The first symptom that deserves attention is anemia accompanied by intense fatigue and constant lack of motivation. Vitamin B12 is essential for the proper production of red blood cells, the cells responsible for transporting oxygen throughout the body. When B12 is low, these cells begin to be produced in a deformed way and larger than normal, a condition known as megaloblastic anemia. And what does this mean in practice? It means that the transport of oxygen to the brain, muscles, and organs becomes compromised. Without sufficient oxygen, the body switches into an energy-saving mode. That is why many people report a lack of vitality, difficulty carrying out simple tasks, loss of strength, and even shortness of breath in situations that previously required no effort. It is common to think that this fatigue comes only from stress, a busy routine, or age. But in many cases, the root of the problem lies precisely in vitamin B12 deficiency. The body cannot stay energized without this vital vitamin. People who correct this deficiency often report a true transformation. Energy returns, motivation reappears, and life feels like it has given them a new chance. The second symptom that cannot be ignored is tingling, cramps, and weakness in the legs. Vitamin B12 plays a fundamental role in the formation of the myelin sheath, a layer that coats and protects the nerves. Without this protection, the conduction of nerve impulses is impaired. And when this happens, neurological symptoms arise that go far beyond simple fatigue. Tingling in the hands and feet, that sensation of pinpricks or numbness, can be one of the first signs that the nerves are not functioning correctly. In some cases, cramps become more frequent, even without physical effort. And in more advanced situations, a person may feel weakness in the legs, as if they no longer have the stability to support their own body. This condition can progress into something even more serious, so-called peripheral neuropathy, which affects sensitivity and movement. Imagine not being able to hold objects firmly or having difficulty walking in a straight line. It is a direct impact on autonomy and quality of life. And here is an important detail. Many times, routine tests fail to clearly show when there is a functional vitamin B12 deficiency. The reference values considered normal in laboratories may not be sufficient for proper neurological functioning. This leads thousands of people to receive apparently normal test results while still presenting clear symptoms of deficiency. That is why it is so important to pay attention to what the body communicates. Excessive fatigue, discouragement without apparent cause, persistent tingling, and muscle weakness are warning signs that should not be ignored. The body gives clues long before problems become serious, and being able to recognize them can prevent serious complications. The third serious symptom of vitamin B12 deficiency is memory loss and difficulty concentrating. This happens because this vitamin is directly connected to the health of the central nervous system. Without it, the process of forming the myelin sheath, the layer that protects neurons, is compromised. And when this protection fails, communication between nerve cells becomes slow and inefficient. The result is noticeable in daily life. Frequent forgetfulness, difficulty remembering recent information, lapses that may seem minor but disrupt daily routines. It is common for someone to ask themselves, "What was I about to do now?" Or, "What did I have for lunch yesterday?" This type of repetitive forgetfulness can be mistaken for distraction, but it is often directly linked to a lack of vitamin B12. Beyond memory, concentration also suffers. Reading a book, studying, or even following a movie can become a challenge, as the mind seems unable to retain or organize information as it once did. This creates frustration and can affect both personal and professional life. And it doesn't stop there. Several studies link prolonged vitamin B12 deficiency with an increased risk of dementia and even the progression of Alzheimer's disease. This shows how essential it is to maintain adequate levels of this vitamin not only to have more energy, but also to preserve mental clarity and protect the brain against degenerative diseases. The fourth symptom, perhaps the most striking, is mood changes that can progress into depression. Few people know that vitamin B12 is directly involved in the production of important neurotransmitters such as serotonin, dopamine, and norepinephrine, substances that regulate emotional balance, pleasure, motivation, and even the sense of well-being. When B12 is lacking, the body cannot produce these neurotransmitters in adequate amounts. The result can be persistent sadness, anxiety attacks, feelings of emptiness, and in more serious cases, deep depression. There are reports of people who underwent long treatments with expensive medications and various therapies, but only found real relief when they corrected this deficiency. This does not mean that B12 replaces psychological or psychiatric treatments, but rather that the lack of this nutrient can be a silent and powerful factor that worsens or even triggers emotional problems. Recognizing this symptom is essential to prevent emotional life from being compromised so intensely. Vitamin B12 deficiency, therefore, does not only affect the physical body but also the mind and emotional balance. And that is precisely why identifying these signs early is so important. Now that you already understand the main symptoms of vitamin B12 deficiency, extreme fatigue, tingling, memory loss, and mood changes, it's time to talk about something even more important. Why so many tests end up being misleading and what the truly ideal level of this vitamin in the body is. In most laboratories, the reference values usually range between 190 and 800 picograms per milliliter. But here's the problem. Many people have results within this so-called normal range and yet still suffer from clear symptoms of deficiency. This happens because being within the reference does not necessarily mean being at an ideal level. The range was created too broadly, and therefore it can mask the reality. The ideal, according to recent studies and experts in the field, is that vitamin B12 levels should be around 700 to 900. Within this range, the body is able to produce healthy red blood cells, keep the nervous system functioning properly, and ensure mental and emotional balance. Below this, even if the test shows as normal, the effects of deficiency may already be felt. Another important point is that vitamin B12 does not act alone. It needs allies, such as folic acid, also known as vitamin B9. Together, they work in the formation of blood cells and the protection of DNA. That is why, when investigating your B12 levels, it is essential to also check folic acid, as a combined deficiency can make the symptoms even worse. And what about supplementation? It varies from person to person. Some people only need small daily doses, while others require much larger amounts, especially when intestinal absorption is impaired. In some cases, capsules or sublingual drops are enough. In others, injectable application may be the most effective method. The important thing is not to rely solely on a generic multivitamin, since most of them contain very low doses of B12, incapable of correcting a real deficiency. It is essential to remember that supplementation should not be done randomly. The ideal approach is to carry out periodic tests, at least twice a year, to monitor progress and adjust dosages whenever necessary. The goal is not just to be within the reference range, but to reach levels that truly ensure protection of the brain, blood, and nervous system. Therefore, if you recognized yourself in any of the symptoms we mentioned, persistent fatigue, tingling, frequent forgetfulness, or mood changes, do not ignore them. The body always gives signs before problems become serious. Correcting vitamin B12 deficiency can mean not only more energy in daily life, but also greater mental clarity, emotional balance, and even the prevention of serious diseases in the future. Taking care of this vitamin is an investment in quality of life, in full health, and in years with more vitality. Don't wait for symptoms to get worse before taking action. Pay attention, get the right tests, and seek the proper replenishment. Your body and mind will thank you for every detail of this care.